Welcome to Hope in the Face of Cancer, where we share real stories of courageous people and their cancer journey. Our guest today is a true embodiment of resilience and determination. Bill is a cancer survivor with an incredibly motivating story. While just in his 30s, Bill has undergone over 500 treatment sessions, multiple surgeries, and clinical trials. Despite these immense challenges, Bill has shown remarkable perseverance. He's a loving father, ultra-marathon runner, biking enthusiast, and a passionate advocate for NEC awareness. He continually pushes his limits and inspires others. Now let's welcome Bill to the show. Bill, thank you so much for sharing your story with our listeners today.
Thank you so much for having me, Darcie.
Well, let's start out with a bit more of an introduction of you to our listeners. Tell us a little bit about your background, family, and what led you to us being here today visiting.
So my name is Bill Thach. I am 39 years old. I recently turned 39 back in June 2nd. So I was diagnosed with NEC back in November of 2018. At the time, I was working in the pharmaceutical industry, where I did have a understanding of the medical literature and medical diagnoses, as well as oncology. At the time, I was basically a brand new father. I didn't understand and the nuances of becoming a new father just because it was all new to me.
Right.
I was a new transplant from California to Houston as well, so still learning the layout of the land, as well as just adjusting to the new life in a new state.
Yeah.
I had started basically having symptoms of blood in my stool. So I was like, well, this is kind of odd, but I was like, maybe it's hemorrhoids, maybe it's this. So I was like, I kind of put it off. At the same time, I was recently laid off from my company because of a company reorganization. So I was like, okay, I need to find a new job. I need to make sure that I have health insurance. At the same time, I was like, I have bills to pay too.
Yeah.
So after about a month of searching, I was able to pick up a job right away, which I was super thankful for. And we had insurance day one. So I
That's
went to go
amazing.
see my GP, and he said it's most likely hemorrhoids. But I was like, it continues to happen. It's like, it's been a couple months of this now.
Yeah.
So like, it can't be hemorrhoids because it can't come back this often. So I pushed it a little bit more, and he scheduled some blood work. He scheduled a CT scan. So we did that, and I came back in for my follow-up. I don't think he really paid attention to it. He still brushed me off just because my age is like, it's
Right.
hemorrhoids. So I wasn't satisfied with that. So I was just thinking in my head, I was like, well, is this something that is probably tied to my ankylosing spondyloarthritis, which is a autoimmune issue that I have, where I have really bad arthritis in my back. So I set up a call with my rheumatologist, and he says this has nothing to do with that. So he refers me to a gastroenterologist. So a couple of weeks later, we basically go to a gastroenterologist. We set up a colonoscopy. And then once I wake up, the gastroenterologist tells me, he's like, we found a 6-centimeter mass in your rectum. And we don't know the type of cancer it is. We know it's colorectal cancer, but we sent the pathology over to our pathologist. 1 week later, I find out that it's from MD Anderson, and then I see neuroendocrine carcinoma. So right away, I'm basically doing what all doctors hate patients doing, is going to Dr. Google.
Shame on you.
So I start researching a little bit more, and I'm not finding a lot of information on this cancer.
Yeah.
Majority of the time, I would say 1 out of 50 articles, I'm finding neuroendocrine carcinoma versus neuroendocrine tumors.
Right.
So,
two very different things, right?
Two very different things. So neuroendocrine cancer is a rare cancer that is typically found in neuroendocrine cells, which can happen throughout the body. So it could also produce hormones depending on the type of cancer that you have. With my NEC, I don't produce any hormones. So that also brings a different cascade of different symptoms and side effects.
Mm.
So there's a pro and a con to both of them, just because with the hormone producing cancers, they're typically slower and less aggressive versus the NEC, where they are more aggressive and prognosis is very bad, where majority of patients, depending on the stage and location where it's basically discovered, it could be less than a year that they will survive with this cancer, depending on if their treatment is being effective.
So you were doing a lot of your own research while you were kind of in a period of waiting. And that can be frightening.
Yes.
So, how did you respond to everything that you were learning?
So immediately when I saw this 5-year survival rates, I was like, okay, this is really bad. And I was basically, my focus was like, okay, let's get everything ready for my passing. That was
Mm.
basically my initial thought, just because like, okay, I'm not the type that I don't put myself in denial. I was like, I would rather just make sure that everything's ready. So we basically got all that ready. I basically contacted my family, I contacted my close friends, and I also contacted MD Anderson. Is like, okay, let's get into this hospital as fast as I can.
Yeah.
So the gastroenterologist referred me to a different oncologist where I basically just went through the motions, just because I didn't really understand how to use my healthcare benefits as of yet, just
Mm.
because I'm a young millennial. I was like,
Yeah, you hadn't had
I,
to.
I only
Yeah.
I only go in for physical and just regular blood work or some if something's wrong with me. So
Right.
understanding the healthcare system was a huge learning curve, but
Mhm.
when you get diagnosed with cancer, you learn things real fast.
Yeah. No, I can only imagine. What were those conversations like, especially with your family? And you've got a young
Well, I
daughter.
basically told him like this is not a cancer that is going to be one of those things where I was very upfront. I was like, this is not a good cancer to have. It's very aggressive, and I came from the world of bladder cancer, so
Mhm.
I understood the statistics. I understood therapies and understanding literature and how things were basically done. So as I was reading more literature on NEC, is like, okay, the thing I noticed was that there's an unmet medical need for additional therapies. The
Mm.
other thing that I read was majority of the time these therapies stop working.
Mm.
Majority of the time, these patients do not have good outcomes. And these patients just don't have a good chance. And as I was reading more and more progression within the neuroendocrine cancer space, all the therapies that were progressing were for NET patients.
Mhm.
For NEC patients, they typically use a method of treating it like it's small cell lung cancer,
Oh,
which is another form of aggressive cancer.
right.
But eventually, all those options run out.
So,
So fast forward to today, we have a lot more options in terms of treatment
mhm.
with targeted therapy, with immunotherapy, but these weren't options when I was first diagnosed. So
Mhm.
things have changed dramatically. And if we could basically accelerate that a bit faster, patients like myself or future patients can have a fighting chance.
Absolutely. Well, it's incredible that in just a few years you've seen the advancements, which is certainly very promising. Tell us about your treatment journey. I know it's been incredibly daunting. So tell us a little bit
So
more about that.
treatment journey. So for with NEC patients, typically we start with platinum-based chemotherapy. So in the very beginning, I did 6 sessions of carboplatin and etoposide. So typically, platinum therapy has a very good efficacy with reducing the size of the tumors, which it did.
Mm.
It reduced the size, but as I said previously, this is a very temporary thing. So after our 6th session, we saw progression.
Mhm.
So the very next thing we did after that was capecitabine and 25 rounds of radiation at the same time.
Wow.
So we did that. It didn't shrink the tumors, but it just kept it stable. So we moved to the next one because I was like, I had progression again. We had stable disease for a few months, which then my surgeon basically asked me, he's like, do you want to move forward with surgery? This is going to be a very large surgery.
Hmm.
So it's going to be about 18 hours. We're going to remove your rectum, your prostate, your bladder, both of your seminal vesicles, parts of your liver. We're also going to do reconstruction of your abdomen and your pelvis. We're
Wow.
also going to have a radiation oncologist to radiate all the margins. We're then going to have a plastic surgeon do the reconstruction on your pelvis and your abdomen, pelvis and abdomen, but we're also going to have him shut you up down there because you won't have a rectum anymore. So you'll have both a colostomy and a urostomy bag as well.
How tough a decision was that?
Um, it wasn't a really hard decision just because the way I was thinking was, okay, this cancer has invaded so many organs. So I was like, I saw it as a reset, just a
Wow.
hard reset. So I was
Yeah.
like, remove as much as you can right now, and I'll deal with the consequences later.
Wow.
So we did the surgery. Um, Literally right after that, an hour after surgery, they woke me up. It was like, it's time to walk. We got to make sure your bowels are going to start moving. I was like, whoa, whoa, whoa. I was like, because I was like looking at the time, I was like, wow, it hasn't been that long.
Yeah, that's incredible.
So literally every 2 hours, they got me up to go walking, which in
Hmm.
the beginning, it was very hard, but I understood why they had to do it.
Yeah.
I was in the hospital for about a week, and then they discharged me. And then after 2 days, I had a bowel obstruction and then got sent back to the ER. And then I stayed in for probably another 2 days and then came home again and had another bowel obstruction, came back into the ER. And then that was the first time I had an NG tube stuck up my nose and down my throat. And that was a horrible session. And then I went home after a couple more days. And then right after that, I was like, I started walking a lot. My wife got me a walker. So the first time I walked outdoors, I was able to walk about 2 miles.
Wow.
And then we tossed the walker after about 2 weeks. And then I started walking on my own. And then literally a month after surgery, we had a liver ablation to get the remainder of the tumors that they couldn't get in surgery.
What an incredible treatment journey. And to see you, and for those that are just listening and not watching this video, you've got this bike, right behind you on the wall. And I'll fast forward a little bit on your story. Um, Pretty incredible that what you are doing today physically. Tell us about that journey and kind of what made you decide, hey, I'm going to try an ultra marathon. I'm going to try this with all of the challenges and, post surgery, the changes in your body. What made you kind of take that huge leap?
So the ultra marathon was more of it was a stretch goal for me originally.
Mm-hmm.
When I first got diagnosed, typically with chemotherapy, they always give you a high dose of steroids before starting treatment.
Mm-hmm.
And this gave me really bad insomnia. So I'm a really restless person who doesn't know how to sit still. So I would be pacing around my house and I got tired of that. So I
Yeah.
started walking around the neighborhood at the weirdest times of day. And it didn't really matter what time it was. I was just walking. I was like, it cleared my mind.
Yeah.
It just got me moving. And I noticed that it did help with treatment just because I noticed my nausea and my fatigue would go down too.
Mm-hmm.
So I was like, and then as I was doing more and more research around physical activity and cancer and treatment, there was a consistent pattern where exercise helps so much with cancer treatment. So I just continued that. And then in 2019, I spoke to my dad and he was like, do you want to ride a bike? I was like, sure. So he shipped me his bike in the summer of 2019. And it's only been about 6 months of treatment so far. And when he sent me his bike, I started riding the bike around the neighborhood. And then again, with the weirdest times of day, because I'm on chemo, I'm on high dose steroids. So I'd be riding my bike around 2 in the morning, 1 in the morning, 4 in the morning, and all around the neighborhood. So, and then I started getting the itch. I was like, oh, I actually really like this. So I started, I bought my own bike, and then I started riding with a friend or other cyclists, and then with clubs where I was like, okay, I'm starting to learn how to shift gears on the bike. I'm learning how to use the bike correctly. And then I was like, I'm building a foundation of friendships.
Yeah.
So we do that. I'm still undergoing treatment. It literally 6 months after, a little less than 6 months after my surgery, I had progression, which I wasn't too surprised about. I kind of wish it lasted a little longer, but my radiation oncologist, as well as my colorectal surgeon, told me is like, you have a 99 to 100% chance of this coming back.
Wow.
I was like, I was like, you are not in remission. It's like, you're only no evidence of disease for now. So that's the thing with neuroendocrine cancers. The neuroendocrine cells, they could have micro metastasis anywhere in the body. And it's just one of those things where it's like, when is it going to pop up again?
Yeah.
So it came up, and this is now the start of the first clinical trial that I jump on. So olaparib and RP 3500. So we found out that I had an ATM mutation when they took tissue from my surgery. So this was actually my saving grace. And this is where the forefront of medical advancements have really extended my life, because the ATM mutation is typically found in pancreatic and breast cancer patients.
Okay.
So with the very first trial drug that I was on, olaparib and RP 3500, it kept me stable for 23 months, so almost 2 years.
Wow.
But the dosing would be twice a day, 4 days on and 3 days off. So I didn't really have much of a break, where the 3 days I did have off, it was basically just enough where it didn't make me feel normal, but I just didn't have really bad side effects. So as I was on this drug, I wound up in the ER a couple of times for for low hemoglobin, where I needed a blood transfusion. Me being the way I am, I always put myself in hairy situations where it's like I'm pushing myself a little bit too hard. And I found out that time when I did need the blood transfusion, I noticed my hemoglobin was around 7, where I found out that, okay, my wife's an occupational therapist. She said, we don't get patients up if their hemoglobin is 8 or lower. I was like, oh, okay. I went on a 50-mile bike ride with hemoglobin. So I was like, then I kind of had a marker. I was like, okay, if this blood marker is around this, I'm probably not going to go outside.
Yeah.
So with the olaparib, it also caused severe cramping, Charlie horse-like cramping throughout my body. So my neck, I would have it in my calves, my quads, my shoulders, my hands, my eyes. It was weird. And I was literally the only one on the clinical trial that had that reaction. So the original diagnosis was autoimmune hepatitis, because I was basically grade 2 or grade 3 liver, getting close to liver failure if the numbers kept going up. The doctor basically put me on a medication to get that under control. It did bring it down, but then it kept going roller coastering. So literally 4 months of not being on treatment, which is really bad for NEC, just because it's somewhat of a death sentence, not being on treatment for that long. So we really know that it didn't work. So we did 84 doses of that medication and it didn't work. So that was treatment number 7 now.
Goodness.
So within this time, that's when I started running. So on January 6th, I started running. I was like, oh, I'm not cramping anymore. So I was like, okay, so I started increasing the mileage on my runs. And the surprise to me was that I thought because I had endurance with cycling, it would help me a lot with running, but it really didn't, just
Two
because
totally different things.
two totally different things. Like the only thing I was able to transfer in terms of knowledge was fueling and just being able to push myself, like suffering. So fast forward 2 months in mid-March, I decided to do an ultra marathon as a
And this is
stretch goal.
2024, right? This year?
Yeah, so 2 months
Yeah.
literally after of running.
Wow.
So I signed up for Brazos Bend 50 on April 6th. And I'm still adjusting to my new treatment. I'm now on another treatment, so it's making me throw up a lot. I'm nauseated, I'm fatigued, but it's like the thing that's always worked for me in terms of bringing that down is exercise.
Yeah.
So I had all the excuses in the world to not do the event. I was like, I come home at 6 or 7 in the evening, so I'm pretty tired. I try to go to bed right away just because, like, okay, I got a big event tomorrow. And of course I can't. I'm the type that if there's a big event the next day, I can't sleep.
Right.
Then my dog Gabby, she just recently she got spayed. So she couldn't get out of the doggy door because she had a wound under her belly.
No.
So I had to open the door and she would just go in and out multiple times. So I was like, she was keeping me up. So it came at it was 2 in the morning. I was like, screw this, I'm just gonna get up. So I was like, I started getting all my supplies ready, and then I took my medication that morning, and then my wife dropped me off at the event, and then I walked the event, and it took a little over 8 hours to run 31 miles.
That's incredible.
So
Congratulations. That's an incredible feat for anyone, but someone going through what you're going through right now and what you have gone through. It truly is incredible. And I can imagine that it's been not just about the exercise, which is so good for you, whether you're in cancer treatment or not, but I can imagine that it's been a bit of an emotional, mental release as well. I think, everyone has to have an outlet, during
yeah,
their cancer treatment, and that's been your outlet.
yeah, and then that's the issue with cancer is like it's an emotional roller coaster.
Yeah.
All individuals have a different way of just getting through the stress. Mine is exercise. Granted, it's fairly excessive, but it works. I'm not saying it's going to work for everybody.
Right.
I do recommend physical activity, regardless if it's 30 minutes a day or 2 hours a day. It's like whatever you can do is good.
Yeah.
Not too long after the ultra, I find out that okay, the Vidalimab's not working now. So I was like, okay, now we have to go through the motions of another clinical trial. And if your viewers don't know anything about clinical trials, the very first 2 cycles of the clinical trial are extremely intensive just because you could have very long days at the hospital. You're at the hospital fairly frequently, and they're monitoring you just to make sure that you don't have adverse side effects just because they don't know anything about the drug, depending on if it's phase 1 or phase 2, where majority of the trials I've been on are phase 1. So I was like, okay, I'm like the perfect patient for these clinical trials because like you're healthy. I was like, you're not gonna die. We could dose you so much. It's like it's one of those things where it's like I'm the perfect candidate. And it sucks because I was like, every time I do want to set up travel to visit a friend, it wrench is thrown in the
Yeah.
plans just because I have to basically be at the hospital 3 to 5 times a day. My longest days at the hospital are 18 hours. I'll get there at 5 a.m. and I'll leave at like 9 o'clock at night. So I was
Yeah.
like, it's one of those things where it's like, there are a lot of there are a lot of sacrifices
Yeah.
to just stay alive. Just because it's a give and take. If you want to, if regardless of which treatment regimen that you do, regardless if it's Western, if it's holistic, there's a certain amount of commitment to that protocol. So I start this new trial. It's called IDE 161. So we're in our third cycle right now. So with the first two cycles, so it's 4 days on, 3 days off, somewhat similar to the very first clinical trial, but it's once a day. So we do that. It's showing only 6% progression, which is good because it's a lot lower than the 28%. But then right after that, when I'm supposed to start my third cycle, that day we were supposed to have our phone call and do our introductions with the both of us.
Mhm.
I end up in the ER with COVID.
Goodness. It's incredible that you overcame COVID in the midst of everything your body is going through.
So yeah, so like I had a fever that morning. It went up to 103.2. So I admit myself to the ER, and I drove myself too. That probably shouldn't have done that, but
Probably not.
I was like, as I'm driving to the hospital, I'm throwing up while I'm driving, which is not a good thing. So like, I actually had to request a wheelchair, and they had to wheel me to the ER. I get admitted. They do a COVID test, and then literally about 2.5 hours later, they find out I have COVID. And then they also say, I was like, oh, you have a really bad infection too. So we have to do a crash course of antibiotics on top of that. So I get discharged on Monday. And then on Tuesday, I go for a 7 mile run. And then on Friday, I go for 4. But I was like, I'm basically back to just doing physical activity again. I'm just
That's absolutely incredible. Your tenacity, with your physical health and how you're using it really as a tool, a coping tool, through all of this. I'm curious about, how during this journey you're coping with kind of more the emotional side of things. Are you finding community? You finding folks to talk to, about this? What does that community look like for you right now?
So with community, it was a lot of trial and error. The very first community I found was the Carcinoid Houston NEC group, which is a neuroendocrine cancer support group. But when I joined and I went to several of the meetings, the thing that dawned on me is like, none of this is relevant to me. I was like, all these patients are NET patients. So
The tumors, not the,
I was like,
yeah.
none of this information helps me. So I went to a couple of meetings. I was in their Facebook group and I was active in it, but it didn't help at all. So over time, I found another community where it was a high grade NEC group. And that was the correct Facebook group that I found. And I didn't find them until I would say late 2021.
So you'd really gone through years of this without really having a community of people who could understand what you're going through.
Correct. I was like, I did join the AYA group over at MD Anderson, which I did go to a couple meetings, but it was just when I wasn't working down in that area, it was just a long commute just to go that far to meet with people. So I was like, I found more community in the cycling groups that I attended, where we would do Saturday rides, and then I would just make new friends from that.
Yeah.
But then as I started exploring more of the NEC group, that's where I started finding more community. Just because like, okay, these people have been on the same treatment plans I've been on.
Mm-hmm.
They are experiencing the same side effects that I have been. I have. But the thing that was an issue to me, which is unfortunate just because majority of people think that people who get cancer are majority older. It's an
Yeah.
old person's disease. But this, I'm pretty sure a lot of people within my age or younger than me can easily echo this, where when they come to a cancer center, they're probably the youngest person in the room.
Sure.
Where that kind of made me feel a lot more lonely, just because you have a majority of these folks where I was like, they've been able to live their life. They've been able
Yeah.
to see the world and experience things they needed to experience.
They may not have
Whereas,
young kids like you.
correct, it's like, whereas people like me, we're getting our career started. We got diagnosed with this. We just had kids recently. And we're trying to navigate this all on top of everything else, because life is not easy. And then life with cancer is even harder.
When
So,
you found your NEC group, was that the same case where most everyone was significantly older than you?
oh yeah, I would say
Yeah.
95% of the people are
Yeah.
older. So it's still, the unfortunate thing is that I'm seeing a lot more people in my age category get diagnosed with this cancer, which is very scary. But we're also seeing that statistic in almost every other cancer, where
Absolutely.
there's a
Younger
lot more
diagnoses.
younger diagnosis. A lot of it could also be part where we have better technology in terms of diagnosing. But at the same
Yeah.
time, like, there's probably a lot of things at play where it's basically increasing the rate of cancer rates. But I was like, it's a very scary thought, just because like all these people who are supposed to be enjoying their milestones in their life are getting diagnosed with cancer. And unfortunately, I was just one of those people. But I'm not going to let that diagnosis basically stop me from doing what I want to do.
Well, I think you're an incredible example of how someone young facing a very difficult diagnosis and a very difficult treatment can overcome so many odds and do things that most people wouldn't fathom who are 100% healthy. I think, your story getting out there can be such an inspiration to folks, even facing cancer, that they can do things that to push yourself, in the sense of it doesn't mean you can't, try things that maybe you never would have tried, that, just be bold, be courageous in this, and look what you've been able to accomplish. So I think your story will be so helpful to so many to look at you and what you're doing in the midst of your cancer treatment.
Hmm.
So tell us a little bit about the advocacy work that you're doing now, the fundraising work, and you've really turned this journey into a mission for you, to inspire, to educate, to raise funds, to find answers. Tell us a little bit about that work.
So, in terms of my advocacy, it took me 5.5 years to learn
Mm.
that I wanted to do this.
Yeah.
I really wish I I found out this earlier, but it's better late than never. I want to advocate just because there are no when you look at all the other cancers, there are advocates everywhere for that type of cancer. You look at colorectal, you look at prostate, you look at breast cancer, and you look at lung cancer. There are so many people that are advocating for this disease. But when we look in terms of the neuroendocrine community, I see a lot of advocates for NET, but I
Hmm.
hardly see anything for NEC. We have the leader of the group from the NEC high grade group, Susan Meckler. She advocates, but she is helping. She's a lot of majority of her time is spent helping patients.
Yeah.
So it's like she doesn't have the time to advocate. Where I'm one of those patients where I'm an outlier, where I was like, you know what, I have the energy. I'm so young, and I'm going to do it. So in March of this year, around the time where I wanted to decide to do the OTRA, like that's basically when I wanted to basically start advocating. And I set up a discussion with NetRF, which is a research foundation who basically uh, puts together grants for all the doctors and researchers that go into this field, and they are the largest. Where we worked a agreement where I will raise money for NEC research.
That's amazing.
So they helped me create a donation page. And we basically I also decided that I will run a ultra marathon self-supported on November 10th, which is World Net Cancer Day.
Mm-hmm.
So if I could basically just bring more awareness, find a pack of people who would like to run the event with me and just conversate,
Yeah.
let them know my story. Um, if I could help others and inspire others, where I was like, because majority of people, the one comment I get more times than I could even count is, you don't look like a cancer patient. So my question to them is, well, what should a cancer patient look like? So I was like, because if you watch too much TV and have this image of a cancer patient in a hospital bed where they can't do anything and they're throwing up, they have no hair. Well, I have no hair, but that's just by choice. But I was like, we need to throw away um, what's that called? Stereotype that a cancer
Yeah.
patient should look like this. Um, there are many cancer patients that can walk around and everything. It just depends what kind of treatment they're on. And it depends on how well they're tolerating it too. I was like, the image of the stereotypical cancer patient not looking like that, that is true. I was like, but it's not everybody.
Yeah.
But I was like, but it's also dependent on, I was like, there's so many different factors into that image. Yes, I was like, I was like, when I restarted my clinical trial, literally 45 minutes after I took the dose, I was throwing up in the sink.
Mm-hmm.
But I was like, that is true. It's like fatigue is real. Nausea is real. I was like, unfortunately, no nausea medicine has worked for me. I've been on 6 different nausea medicines, and the only thing that works is exercise.
Yeah. You've certainly broken the stereotypes. So, if someone listening to our conversation today hears about your advocacy work, I think many people would say, well, I can't be an advocate. You have to have something, you know. But anyone can be an advocate. What would you say to them about your advocacy journey, about how one man can make a difference?
If you're willing to talk to somebody about a cancer, then you are an advocate.
That's right.
If
That's
you
right.
have knowledge that someone doesn't know about that cancer and you tell them, you're an advocate.
Yeah.
Being an advocate doesn't take a lot. Being a advocate that could move the needle, that's a totally different story. Um, I'm hoping there's been a huge learning curve for me in terms of learning how to advocate. But if I could continue to get my story, my voice, and my goal presented to a wider audience, then I'm at least I'm at least creating momentum to a point where, okay, not just one person knows about it. Not just 10 people know about it. If I could get to the hundreds, if I could get to the thousands, everybody starts at the bottom.
That's right.
If I could basically continue to grow that base and knowledge, then I will be happy about the fact that I could raise the awareness, just because not many people know that Steve Jobs is the most famous person that died from neuroendocrine cancer. He didn't have
Yes.
NEC, he had NET, but the thing is, majority of people think he just died from pancreatic cancer. No,
Mhm.
he died from pancreatic nets. And
Yeah, I wasn't aware of that.
so I was like, Aretha Franklin is another one. She died from NETs. So I was like, a lot of these celebrities are very influential people kept their diagnosis private.
Hmm.
Where I was very private in the beginning, but now if I'm going to continue being private, no one's going to know.
Yeah, you can't help anyone that
So
way.
it's definitely a risk to my privacy bringing this story out. But if I don't do it, then the people in my community and my cancer population will be forgotten. And I've started reaching out to people. There's been posts made on social media where more and more patients are reaching out to me now, where I'm helping lead them to the correct resources, just because not everybody is a net specialist. And I've seen this time and time again where an oncologist will say they're a net specialist and they give them the wrong treatment. So this is why advocacy is so important, just because we want to make sure, because I tell all my friends and family is like, when you have a choice to get to find a provider, make sure you make the right decision. Make sure you do your research and everything, because that could make or break you living long term.
Certainly. So tell us about your hopes and dreams for the future, your legacy.
My hopes and dreams are I hope that the new treatments that are being offered today and in the future can keep me alive long enough to continue my advocacy. In terms of my legacy, is like I would love the fact that if other NEC patients can find my story,
Yeah,
that they can continue my work, continue Susan's work, where we could progress and move the needle to make this into more of a chronic disease than a death sentence. Because I know we're not at the point where I will ever be cured. I know this will kill me, but at least with the time I still have here, I could try to make a difference.
well, and part of your journey is you're becoming a CanCare volunteer very soon,
I
and you'll
am.
be able to,
So,
yeah.
and that was when I discovered CanCare through Sandra Beno, I was like, this is a great organization because you guys match a patient with another patient that has the same exact disease. If I had that in the very beginning, my outlook, my thought process, as well as my knowledge base would be so different.
Yeah,
And if I could give that time to another person with my cancer, that'd be great. Now the question is if I will ever be aligned with another patient with my cancer, since it's so rare.
yeah,
But I can at least maybe talk to another AYA patient where they're a younger patient. And this is another community and population that needs more people supporting them.
absolutely. I mean, I think we have the opportunity not just to match on specific cancer diagnosis, but as you're saying, we're seeing more and more diagnoses in the younger populations. What if you were, matched with other, cancer patients in their 30s and early 40s, and
Mhm.
just the outlook and the way that you've approached your treatment and your cancer journey could be such an inspiration to others. So, even if, we don't necessarily find many people who have your exact same diagnosis, you will be such an incredible help to so many.
Mhm.
So thank you, for joining our family. We're so excited and grateful to you for that. Any final words or of encouragement or advice to our audience today before we adjourn this episode?
The thing I will always tell people is remember what you committed to. I use commitment as a way and as a way to tell people that I was like, remember what you committed to, just like a marathon. A marathon is a test of your private will.
Mm,
If You go into a marathon, everybody comes in fresh. But when things start hurting, when you start questioning every minute and every mile, you're doing the same thing with cancer treatment. Things will get hard. Just remember that commitment, just because once you lose that commitment, you will lose your footing on if you really want to make it through this cancer.
Your hope.
Pretty much.
Thank you, Bill. Your story is so incredible, such an inspiration. I'm so grateful to you for making the decision to share it and to committing yourself to the advocacy work that you're doing. You will and have impacted so many lives. And so we're so grateful for that. And
Thank you so
welcome
much
to the
for
CanCare
allowing me to
family.
come on. Thank you.
Absolutely. We'll see you soon.
All right. Bye-bye.
Thank you for joining us on this episode of Hope in the Face of Cancer, a survivor by your side. If you or someone you know is facing cancer or is supporting a loved one through their journey, we invite you to share this podcast. Thank you for your support in our efforts in the cancer community. No one should face cancer alone.